And I'm with Dr. Rios. Dr. Rios and I met in Dallas at a DAN conference last year in 2009 to understand a little more about autism. And Dr. Rios has taken upon himself to work with a bunch of children with autism and evaluate Lutimax in a clinical setting. So, Dr. Rios, how did you decide on who to choose for the supplement use in autism? You chose the 20 children, and what was your basis for this? You chose because they were a certain type of autism, or just the people were compliant and came to you, or how did you choose?
Well, thank you so much, Tom, for inviting me to be part of your program. It's something that is really fantastic, and I've been enjoying a lot and being part of it, your team. Well, as you know, Nogales is a very polluted town. It's more than 110 fabrics, and we established a foundation almost 2 years ago. And one of the first, and I don't want to call it customers, one of our friends that comes to our foundation is precisely the Autism Association. And I had the chance to go and travel to Cuba, and I learned a treatment therapy. I will say it is ozone therapy. Yes. And I use this in these kids, and it works fantastic. But as a doctor, you always look for something better, for do something else for especially with these kids that stole my heart when they just was in my office, and they asked me once if I want to be part of that team and represent them, because they heard about the DAN evaluation, certification, and things like that, and I said, sure, why not? So, in some way, they invite me, and they give me the support for this. They sponsored my trip to Dallas and Tampa, Florida. So this is where I met you, and I don't believe in coincidence. I believe in Godsidence. So I believe that nothing happened just because that. So I met you there, and I saw all your enthusiasm, and I said, this is the way that I have to follow. So I came very emotionally from that course, and I taught them about your treatment, and so that's the beginning. We with a lot of faith, we put all this wonderful product and under their hands, and they start doing all this evaluation, clinical evaluation. And since that, I would like to fly all the rest of the world and share with other ones about how wonderful is your product.
So you see from this, we looked at 90 days for these 20 children, and the dose was 250 milligrams or a quarter teaspoon 4 times a day is what we recommended. And
that's right.
So from the compliance you saw, they actually did a little less than 4 times a day usually. Is this what you say?
Yeah, most of the time.
Yeah. And when we interviewed the people with their children earlier today, I noticed that some of them only 1 or 2 times a day, yet most of them see really positive results.
Yeah, it's still that change in the doses. They still have good answer, right. Good results.
And so the 4 areas that we looked at were the verbal skills, so their communication and their ability to speak, and their ability to have emotion and intimacy with their family and friends and relatives, and then their behavior to follow direction, and also their sleep habits and their concentration while they're working.
That's definitely right. The comparison about what I saw is that before they were taking the Lutimax, it took them for about 4 years to have at least the same results about taking Lutimax in 4 months. This is the same.
4 years was worth a month?
Yeah.
Okay.
4 months.
And for how long have you been seeing children with autism and other related disorders?
Almost 2 years.
Okay. And also you have your foundation, De Mater Alma, and you also integrate the equine therapy.
That's right.
So tell me a little bit about that, how that's really helped the children also.
Well, we live in a ranch about 12 miles south of Nogales, and we're happy campers there, and we enjoy a lot living there because the same time we're living there, we're providing different therapies. One of the therapies is the hypnotherapist. We have 10 horses there, and we started around a year, and we're seeing a lot of improvement for the kids also, so it helps.
Yes. And we have noticed in the 4 categories, mostly the speech seems to be the first thing, and also the calming down of the children. Can you comment on the speech parts, that what you've seen with some of these children?
I noticed that calm is one of the things that it really helps, and the improvement in speech also is part of this great deal.
Okay. And out of the 20 children, how many did you see improvement in?
It's about 80% of that. And the rest of the kids is because they didn't follow the instructions, or they didn't keep going on a treatment for it, because they went out of the city, because they different matters. But the ones who insist and have a consistency in this, they have a lot of improvement.
So you would say the more consistent the dose and the more consistent that they come in and see you, the better results they
Right.
have.
That's right.
Yeah. Okay, and did they get also counseling for their diet as far as the use of certain foods, or staying away from other?
Definitely, yes. Yes.
Okay. And those types of recommendations you made were based on the starches and the glucose content?
That's right.
Okay. Okay, so, you know, for me, the biggest compliment is when a professional like yourself picks up the ball and takes it to the next step for whatever condition.
We definitely have and still have faith in you and the product, and this happening to us. The motor, the engine that moves us is what the great results. I mean, this is a gasoline for our heart, and it really helps. And it doesn't matter to be tired or working on Sundays or whatever. Once you see the results, I mean, you want to conquer the world.
I agree. Well, Immunobiotics is more than happy to continue sponsoring your work and to help you make this giant leap, because I think it's so important for what we have in front of us. And I can only thank you from all my heart, and all the children that are yet to come that we're going to be able to help. So I thank you and your staff and everyone. I mean, thank God for what you've been able to help do, and to help bring this to not just Mexico, but all the children. It's a universal problem with autism. So
Yeah, I understand this, and I translate in only one word: blessing.